Hey there, it's Dr. Diaz. This video is meant to help with post-op discharge instructions for your rabbit spay or neuter procedure. Now, if your rabbit was spayed today, she will have an incision right in the center of the belly. If your rabbit was neutered today, then he will have some scrotal incisions, so 2 of them, 1 on each scrotum, just very superficial on the skin. Spays and neuters for rabbits, there's a lot of monitoring that will go into the post-op phase by you at home. It's going to be very important to start medications as directed on the label. We'll send home an NSAID, which is meant to reduce pain and inflammation associated with the procedure. We'll also send home some metoclopramide, which is a prokinetic, so it will help the intestines, the guts kind of start moving again. And so we know it's very important for rabbits to eat very regularly, to eat a lot, and for their intestines to be constantly moving. One big concern would be GI stasis after anesthesia, and that can happen sometimes. It's very rare, but it is a potential complication. So we do everything we can to help mitigate that risk and reduce this complication post-operatively. So medications are very important for that. During your rabbit's procedure, they did receive the spays. They do receive IV fluid therapy to help keep them hydrated and to help with the gastric movement. Male rabbits will also get fluids, but these will be administered subcutaneously or under the skin. They will also get medications, including vitamin B12. They will get an injectable form of metoclopramide. They will get some Serenia, which will help with any potential GI side effects. Very important is eating after the procedure. We will be keeping an eye on them through the day to ensure that they are eating, but just watch them closely at home, make sure that they do start eating, and if not, you will have to assist feed. So we'll be sending home some critical care, which is a powdered food. You'll mix it with water in a syringe and administer that by mouth. We can have one of our technicians show you how to do that as well. Your rabbit will not go home with a cone or an e-collar. Typically when there's good pain control on board, they don't bother the incision sites very much, but definitely let me know if you are having any trouble with that, if your rabbit is starting to groom or chew at the incision. In addition to that, it will be important to restrict activity, so keep them in a confined area. If there are multiple stories, try and limit access to any top story so they're not wanting to run and jump around. Avoid any free roaming, and this should be for about 1 week while everything heals both internally and externally. I definitely would like for you to call and reach out if you notice that your rabbit has not eaten for 24 hours, if they seem very lethargic, if there's excessive bleeding or bruising around the incisions, call us right away. A little bit of bruising is to be expected. Some crusting and scabbing can also be normal. But if there's any discharge, any bleeding, or any abnormal odors at the incision sites, please let us know. For tonight, you can expect your rabbit to be quite sedate and sleepy. That can be pretty normal after the procedure, but either way, just make sure that they have a nice comfortable area to recover and plenty of food and water as well. Definitely call us tomorrow if you have any questions or you have any concerns at all. That's all I've got for you for now, and we'll be in touch.